life just seems so much better if your skin looks good. And for this patient, a little skin tightening went a long way. And boy, what a difference. She looks great.
She does look good. It's not even Halloween yet, but our next guest says now is the time to start thinking about freshening up your face before the holidays. That's actually something you don't want, is the Halloween mask look.
Right, we're trying to avoid the Halloween mask look, and he's going to tell us how, because that's his specialty. Dr. Andrew Campbell is a board-certified facial plastic surgeon, and he is here to tell you all about the options you can consider, whether you're 30, you're 40, or getting close to 40, okay, 50 or older. I don't know, somebody I know. So good morning to you, Dr. Campbell.
Morning.
It's always fun talking about this stuff. And I guess the one thing I always think about with the procedures that you do is that it's so much more than just making people look better, because I think it affects people on the inside to have better skin or to look younger or to just feel better about themselves.
Definitely. Patients come in usually because they look in the mirror and they don't see the way that they feel. So they're looking at somebody that may look a little older, or just their skin doesn't radiate the way that it used to, but they feel really good on the inside. And I match their inner beauty with their outer beauty so that they can then walk in feeling confident.
And feeling so happy. In fact, you received a personal letter, which I think is so neat, from a patient who is so excited after a facelift, right? And we have some of the letter.
Yeah, apparently it was a gift of a facelift. And she said, "Dear Dr. Campbell and staff, what a wonderful gift I've received. Thank you so much. A year ago, I would have never imagined being in receipt of a facelift, and now that is behind me. I only wish I'd done it earlier. What something like this can do for one's confidence and self-esteem. I simply couldn't be happier with the results. You look like you've been swimming in the fountain of youth," she says. People tell her that all the time.
That's so cool.
She was out with a friend, and she was literally interrupted during lunch, and the friend said, you just look like you've been swimming in the fountain of youth. And she kind of smiles because she'd had some work done by me and just feels good on the inside and it shows on the outside.
What did you do for her? And is it typical of if you're doing something for someone's face, what you did is very common?
Yes. It really depends on the person, their age, their aging, the way that they age. Mm-hmm. So it can start as young as even in their late 20s, where somebody uses the muscle here a lot and they have a deep line. We can just do a little Botox. There's no downtime. It works wonderfully. And then you can work your way all the way up to what I did to the woman who wrote me the letter, which is comprehensive facial rejuvenation. I did an endoscopic brow lift. I did her eyelids. I did a deep plane facelift. I did laser resurfacing of the skin. And after 2 weeks, she's looking great. And by 1 month, 2 months, and all that little bit of swelling that's left over goes away, she looks absolutely stunning.
Dr. Campbell, one of the things we were talking about, I had told you about this dentist that I knew who was using Botox on herself, which you deemed highly irresponsible, and she had paralyzed her face. And Molly and I were making the joke about the ladies that look like this, and that's not the look you want for that you're going for it. And I said, people do this like they're getting their oil changed, and this is a medical procedure.
Yeah, I think people are taking this way too lightly, and they need to be aware of who's injecting them, their training. I mean, obviously, being a double board certified facial plastic surgeon, I'm going to tell everybody, you need to go see a double board certified facial plastic surgeon for your Botox, for your wrinkle fillers. There's a lot of people out there doing wrinkle fillers and Botox, and they have a nurse injecting them.
You said there was a dentist that you've heard
There's
of
a dentist,
doing...
yeah, sure. There's people that advertise, there's dentists that advertise Restylane for lip augmentation. I don't think that's a great idea. I think you should stick with people who are specialized in the area. You don't get any more specialized than what I do. I'm a double board certified facial plastic surgeon.
Which means what?
That means I have 2 different board qualifications that are both for facial plastic surgery in the head and neck area.
What should you do? Should you do the facelift sooner rather than later? Should you do that early one if stuff starts going south?
Yeah, the earlier you do it, the longer the results are going to last, because you're dealing with more elastic tissue than inelastic tissue.
Really?
And it's going to be a more subtle change. You come in at age 60 and you have marked features of aging, and I do a facelift on you, you're going to see this drastic change from your preoperative to your postop. It's a wonderful result, and don't get me wrong, but it's going to be obvious.
Your friends are going to freak out.
Well, it's not that
Your husband's going to go, "Who are you?"
Yeah, you look so young.
Honestly, it's kind of amazing what people don't realize. They don't remember exactly the way people used to look. They may comment that, "Wow, you look great," but they're not really sure why. If you looked at before and after pictures, you'd be absolutely stunned by the difference. But people don't pick up on that. So it's still safe to do at a later age, and people really don't notice if it's done well. You have to do it well. You don't put tension on the skin. You're not going to give them a stretched look. You want to make sure that you're putting the tension on the deeper layers of the face so that you can close the skin without any tension. And I can make scars that are virtually invisible. I'm not creating a stretched look on the face, so they look very natural. And nobody's going to realize that surgery was ever done because they don't look like a surgical patient. I mean, Joan Rivers and Phyllis Diller and these people have given the word facelift such a bad name that some people are actually not using that word in their office. They'll call it something else.
This rejuvenation thing, is that a facelift, facial rejuvenation?
It depends on what we're doing.
It could be a different procedure.
Yeah, we can start with the 30-plus-year-old, and we're dealing with Botox and wrinkle fillers.
That would be me.
Yeah.
I mean, I haven't done it yet, but I'm thinking I'm open to it, Dr. Campbell.
Yeah,
late
she's
30s,
open to it.
late 30s, 40s. You know, I'm doing endoscopic brow lifts. These are things that you have minimal downtime. I mean, it's a surgical procedure, and you get a wonderful improvement, but it's a subtle change, but it changes your image so much. It's just a wow difference, and yet it's subtle, so nobody notices. You know, eyelid surgery in their 30s and 40s is very common. Again, subtle change, but just gives you that wow, you know, stunning kind of a look. It doesn't detract from your image. It looks very natural. Then you get into your 40s, 50s, even to your 60s, then you're really talking about facelifts. Now, if you're in your 40s and you only have small changes and you just want a little tuck, we can do mini lifts. You know, there's the lifestyle lift. It's a weekend lift. You can do it in the office. There's no general anesthesia. You know, you go home the same day. You take the stitches out in 4 days.
No anesthesia at all.
Well, local anesthetic, just like a dentist.
Shot in your face, something like that.
Well,
wow.
A gentle application of anesthetic to the face.
I prefer the latter.
Amy says a shot in the face.
It's extraordinarily tolerable. It is so easy. We have music playing. There's a lot of little tricks that I do to make sure that the patient's very comfortable when we do procedures like that.
It sounds kind of romantic, actually.
Yeah, it does. It sounds very wonderful. We're running out of time, but really quick, if we're able to pull up one of those pictures again, I just want you to talk through as quickly as you can about what you did, because I think the results are very dramatic when you look at the before and after, because it's just even the skin texture and everything looks different.
Well, I mean, first of all, I'd like to say that she doesn't look like a different person. She still looks like herself. Her skin, obviously, is much more radiant. There's not as much discoloration to it. The fine lines are virtually gone.
How do you get rid of those age spots in the color?
That was an erbium laser resurfacing. So it takes about 5 days to heal. You don't look very good for those 5 days, but you look great after that.
Yeah, I'll say. She looks 20 years younger.
Exactly. She had an endoscopic brow lift. She had an upper and lower lid blepharoplasty, which is the eyelids. She had a deep plane facelift, and she had the erbium laser resurfacing. And again, it's a very natural-looking result. You would never look at her and think she'd had anything done, but obviously a big difference from the before and after.
And I like that you pulled her hair back, because you don't see any scarring or problems.
I want to show you that you don't need to hide your scars, because the scars that I create are almost invisible.
She doesn't look stretched or pulled. And
right.
A doctor told me one of the first signs of aging you'll see in women are these folds. What are they called?
Yep, the nasolabial or melolabial folds.
Yeah, this line right here. Yeah. There's kind of a newer product that can help that on the market.
Yeah, the wrinkle fillers, whether it's Radiesse, whether it's Juvederm, whether it's Restylane, those are kind of the 3 most common ones that I certainly use. And they do a wonderful job of filling that area. You can also do fat transfer. And then the deep plane facelift that I just discussed is really the only surgical technique that's going to help that fold. The rest of them tend to pull on the skin and that fold comes back.
Is that a traditional facelift?
No.
When you say deep plane,
That's a very different procedure. It's releasing some ligamentous attachments that are deep in the face so that I can lift vertically, and that completely regenerates or rejuvenates the face in the direction that you've been aging. Whereas facelifts, typically the traditional facelift is pulled at an angle, so that gives you a little bit of that pulled look.
Yeah.
Whereas if you can pull vertically, it's just reversing those signs of aging in such a natural way, and then you just redrape everything and get rid of extra skin and close the skin under no tension so that you have a very fine scar.
Dr. Campbell, thank you so much for being